What can you tell me about scars?
So the scar depends a little bit about which surgery you get. So if you get a spine fusion procedure, which is the most common, it'll be a scar directly in the middle of your back. So it's not something that you actually will be able to see very easily. Often you'll need to either take a picture of it or someone show you. But if you want to keep that as light as possible, it's important in the first 6 months to make sure it doesn't get a lot of direct sunlight. So keeping it out of that direct sunlight will make it just be a little bit thinner and a little bit harder to see, not as dark. If it's a scar from a vertebral body tether, it's more on the side. So you'll have 3 small scars kind of under the armpit here, which are pretty hard to see. They're about that long. And then 2 smaller ones more towards the front that are only about that wide.
All of our stitches that we use are absorbable, and we use it in a plastic surgery type of technique. Typically, as scars heal, as blood flows to that area, they tend to get a little bit beefy or red in the initial postoperative period. That tends to fade over the course of several months, up to about a year. So in the first year after the surgery, it's a good idea to protect that scar from direct sunlight. So if you're at the lake, at a pool, using a rash guard, or at the very least using a heavy sunscreen like an SPF 45 or above. That's going to help that heal in the most cosmetically acceptable form possible.